Hi, Dr. Nicole Nemeth here. I'm a board-certified plastic surgeon here at Plastic Surgery of Westchester. Today I'd like to discuss a topic that is on essentially every patient's mind, and that is about their scars from surgery. So let's talk a little bit about scars and how do we make them as good as possible. With any sort of surgery where we make an incision, you are essentially going to have a scar, and those scars are going to take time for them to sort of flatten and fade and become more consistent with like your skin tone, for example. So one thing that we have to remember is that this takes time and we need to be patient. That being said, there are certain other factors that play into why a scar may look the way it does, especially in the immediate period. And the first is going to be your genetics. So some people just tend to heal a little bit more quickly, or their scars will tend to mature a little bit faster. The other thing that plays a role in this is going to be the skin type and tone, and of course that plays into genetics. But again, some people may heal, especially in the immediate period, with a more raised or darkened scar. But with time, most scars will flatten and fade. It just can take a little longer. The location of where the scar is placed, so for example, if we're operating across a joint or extremity, that scar might tend to widen. And this has to do with the location of the scar more than the surgery itself, for example. Also, if it's under an area of high tension, that can lead to a scar taking longer to heal or widening during the process. The last bit is surgical technique, and sometimes there are ways that we can close or suture types that we can use to help mitigate this. And of course, we are thinking about this during the surgery. What do we do about making the scars look better or heal more quickly? The first thing that we recommend is sun avoidance. We always say, keep your fresh scars out of direct sun exposure. And when the time is right, we will give you some examples to show you what you can do depending on where your surgery incision is located. The next thing that we'll talk about when the time is right is going to be scar management modalities. So this will include scar massage, where we actually will say, take your finger and start to gently press on the scar or massage the scar. And oftentimes this will be combined with a scar gel, such as a silicone component or a silicone sheeting that can actually be put on the incision. And this will provide constant pressure and silicone treatment to the scar during the healing process. It is important that you pay attention to your nutrition, and with most surgeries, we recommend that you do include good protein and vitamins such as vitamin C and zinc as the precursors and building blocks to healthy collagen production, and this will allow you to have the best scar. These are all things that we will counsel you as you go through the healing process, and of course, if there's any questions, we invite you to reach out and discuss these with us, and we'll be there every step of the way along your journey. Feel free to give us a call.